Good afternoon once again to our audience, and welcome back to the second half of today's Science Business webcast on value-based healthcare beyond COVID, supported very kindly by our friends and partners at Novartis. And in the second part of today's discussions, we are going to look a little bit more at the prospects and some concrete steps for accelerating access of treatments, solutions, and so forth within healthcare systems in Europe as part of the broader response to the COVID crisis and as we enter the recovery phase. And so to join me for this rather important topic, I'm very pleased to welcome four eminent guests to today's panel. First of all, Francesca Colombo, who's the head of the health division at OECD. Accompanying her, Klemen, who is a member of European Parliament from Slovenia. We also have Momir, Radulovic, the Executive Director of the Agency for Medicinal Products and Medical Devices in the Republic of Slovenia. And finally, Janneke Kamp, Head Region Europe for Novartis. A very warm welcome to you all, and thank you again for your patience as we dealt with some of these rather irritating IT issues. But the focus of our discussions is really going to be on how we can apply some of the practical lessons that have been learned from the pandemic response experience to date to advance not only the broader process of healthcare systems transformation, but how the well-established principles of value-based and outcome-based healthcare can be integrated into the new designs, the new policies, and the new platforms put in place to support health and to promote better well-being for patients in Europe in the years to come. And so I'd like to open with a question for all of you, and we'll just take a very quick rotation of 1 or 2 minutes to get your opening thoughts on this. And the question is basically this. COVID has thrust health and patient outcomes into a unique and unprecedented global spotlight. So how are you or your organizations defining or thinking differently about this going forward? And that can be at population or at patient levels. So perhaps, Klemen, let's start with you from the European Parliament. What's front of mind for you when you think about the future of health systems, patient outcomes, and what's currently on the table in terms of legislative and policy actions?
Thank you. Good afternoon. I would say that one of the major lessons learned from the COVID-19 pandemic, at least from our, let me say, political point of view, is that the importance of research and development and investment in research and development, and above all, the transfer of the results into production. So what happened with the COVID-19 vaccines proved us that there is not only need for investment in, I would say, applicative part of research, but also in the basic research. And there is a lot of ambiguity and uncertainty related to the research work. But nevertheless, for this reason, I would say that we need a new framework for the research and development, especially in the sense of risk sharing. In this sense, that we should achieve the best possible, to have a new model which will enable us to exploit to the best possible way private-public partnership in this sense. I would also say that we need a new perspective to provide an access to medicine and medical devices on one hand, and on the other hand, also to have a mitigate costs through a set of new approaches. I would say that one of them being this we are talking today, patient-reported outcomes, and this also has as I said before, show us how important is the research and development investments. So the next issue I would say is that COVID-19 also pointed out is the question of the so-called EU strategic production autonomy. I'm not in favor of protectionism or nationalism in the pharmaceutical production. What I see as a way forward is I would rather think in the terms of smart autonomy, which would provide the whole link between the research and development, regulatory framework, and to production, so that we have the aim is to have a guarantee of stable access to medicine and medical devices while maintaining technological edge and competitiveness. In general, and this means that we need a comprehensive approach also on the EU level. I mean by this that when we are doing this all different strategic documents on EU level, like industrial strategy, the IP roadmap, and other documents, we need to have a comprehensive approach so that we look all the aspects which are relevant for the future development of the industry and also what are the implications for the healthcare systems. As far as I would say that part of the solution is also the EU healthcare policy, although I would say that we first need to very carefully consider what are the main goals of this EU health policy. I don't think that EU can play like a role like provider of the healthcare system for the whole Europe. I think that EU can play an important role in procurement of medicine and medical devices, in the field of research and development, in setting up a certain basic standards of healthcare. Like we have now a very vivid discussion about the minimum wage standard, something like similar. But at the end of the day, I still think that the basic responsibility for the healthcare system as such is still in the hands of the member state. The other issue I think is also important to stress from this political point of view is the bigger role and reinforcement of the legal and regulatory framework. I think that one of the topics with which we as politicians will need to take care of in the future is the question of regulatory framework in the European Union. I think that COVID-19 exposed very clearly that even the strongest national agencies and regulatory bodies were facing difficulties and serious challenges in this throughout the COVID-19. So I think that EU can definitely play a major role in this field. So making EMA stronger, providing it with more expertise, with more expert knowledge, so that its position as EMA is stronger in the future. Of course, still there is still room and place for national regulators, but I think that EMA should play a major role.
On a very positive note there, and we'll come back to some of these questions about capacities, the role of agencies, standardization of certain practices a little later in the discussion. Let me turn now to Janneke. I mean, Janneke, Novartis has been at the forefront of a lot of the thinking and supporting platforms around value-based healthcare, patient outcomes, and health system innovation in the last few years. So how do you see this field evolving as we go forward?
Yeah, thank you. And maybe I'll focus a bit more on the healthcare delivery side, where Klemen focused a lot on R&D, manufacturing, etc. Because I think we have a unique opportunity now that the value of health for society is so clear to everybody. It was already clear to all of us, but now it is the #1 societal topic. All eyes are on healthcare. So this is the moment where we can, as you said before, draw the lessons from the past year and build back better for the future, improve the resilience, improve the efficiency of healthcare systems, and indeed make sure that we all together become even more outcomes focused. And that is not easy. I think to truly become outcomes focused in healthcare delivery is fundamentally something that I think many people agree with, but it would require a massive change in how we organize and incentivize healthcare. And first of all, I think it requires, of course, a massive upgrade of our data capturing of our digital systems, right? Because if you can't measure outcomes properly, then you can also not organize your system for achieving optimal outcomes. And maybe one example that is involving the pharmaceutical industry and Novartis specifically, I think already a few years ago, we started engaging with the healthcare systems and payers on whether we could move into outcomes-based payment models for our medicines. And while I think conceptually everybody really likes that and agrees with it, to be honest, in the end, we haven't achieved as many outcomes-based agreements as I think we would have hoped for. And the main drawback has indeed been the lack of data availability or the effort that it would take to measure the outcomes of a certain intervention has been, the thing that has been holding this development back. So in the spirit of all eyes on healthcare, let's build back better. That would be one of my focus points, the digital infrastructure, so we can actually measure outcomes.
Thank you, Janneke. Well, let's move to Momir now. Obviously, Momir, you wear a slightly different hat. I mean, you've worked in industry during your career, but now you sit within the regulatory agency in Slovenia. So, to what degree do these insights resonate with you, thinking about how we improve outcomes, how we deliver more value through healthcare in the post-COVID phase?
Thank you, Simon. Thank you for the invitation to the meeting. I would just actually be very brief and add to what was said by Klemen and Janneke. So let me start with the European barometer. So this was conducted in February, March 2021, and European citizens is actually deciding for European Union really high. So the image of EU and trust in the EU is actually increased. And I totally agree that now we have the momentum to build joint EU solutions. In crisis mode, we saw that some principles are not working well, but definitely we should focus on what went really well. We have some learnings in COVID-19, and these joint procurements or this data that we gather on a European level, or regulatory flexibility. Some of the issues here should be further leveraged. If we talk about value means so many different things in health. So this means that either we are strengthening primary healthcare, or we funding healthcare for universal access, or we are setting a health benefits package, or we're just involving patients in their own care. So many different levels. And of course, we cannot do everything at the same time, because post-COVID-19 times will be even more stressful because many diseases and diagnoses were put aside. So we will need to deal with that. But we need to absorb this shock, and I think we sufficiently done so. But in future, we really need to focus on what brings the most value. And I think some things can be really done really fast. We have some low-hanging fruits, but let us discuss this later on.
Terrific, thank you. Well, let's move the conversation on to Francesca now. And Francesca, obviously, OECD has done a huge amount of work with the Commission and other stakeholders in sort of building up some of the evidence base around value-based and outcome-based healthcare. Is there a reason why this hasn't yet become the norm from your perspective, why it hasn't really entered the mainstream? What do you see as some of the blockages that could possibly be addressed as we move into the recovery phase to make it more central to policymaking, to intergovernmental cooperation or cross-sectoral partnerships?
Sure, and maybe if I could even challenge you a bit, I think there has been some progress, and I think we should acknowledge and recognize it, that the notion of really value-based healthcare or looking at health systems that deliver improved outcomes is starting to be something that resonates with patients, resonates with payers as well, and with providers. So I would not be entirely negative. There is still a long way to go, of course, but the idea that there is a vision for health systems that is centered around the needs of patients and how different parts of the system needs to work together to achieve that. I think some progress has started already to be made. Of course, the results are still to be made, and there is much more work that remains to be done. But I think we should acknowledge that something has happened. And in the context of COVID-19, I mean, COVID-19 has clearly shown tremendous weaknesses of health system in terms of the resilience of this health system, in terms of preparedness of health systems. It has, however, also accelerated deeply some of the important critical elements of a value-based health system. Think about the digital technologies, where before COVID-19, we have seen the health was lagging behind decades compared to other sectors of the economy. And I think there has been an acceleration during the context of COVID-19, be it in terms of even telemedicines and telehealth, be it in terms of trying to make sure that data are generated and used in a much more real-time way. Still lots of progress to be made, but at least there has been a push and accelerations, somehow a realization that some of the barriers that existed, that could be institutional barriers, even reimbursement barriers and so forth, they can be lifted if we want to do it. And I think there is an opportunity to build and leverage on this, in a way, huge shock that COVID has confronted us with, to really think about new models for the future. And, the notions of value-based healthcare will be quite important also because while there is a need to invest massively more in health systems, we will be left at the end of this pandemic also with a huge bill to pay, and with amassed also a high level of national debts. And I think the notion really that we do need to invest, but we also need to get better at identifying really what outcomes can be best obtained from each level of investment would be really quite central as part of the recovery processes as well. So blockages still exist. There's been some progress, some accelerations, I think, during COVID, maybe not in the way we would have wanted this to happen. We wanted some of the things to happen without going through a pandemic, but possibly an opportunity to build on it for the future.
Great, thank you very much, Francesca. Now, Janneke, you've been nodding vigorously in the background. So would you like to comment on anything that Francesca just raised?
Yeah, I just very much agree, I think, with what you said around the willingness and the mindset is there. And I wanted to also make sure that my previous comment on the need for, data and digital wasn't misunderstood as a lack of willingness, right? I think indeed the willingness of many systems to move much more towards value-based and outcomes-based is there. There has indeed been enormous progress because of the nature of interactions we had last year, exactly like you said, telemedicine, telehealth. So I see it as exactly like you said, Francesca, as a platform that we should jump from now to further accelerate. The risk is that now everything is up in the air. If we don't act fast, everything will fall back into its old place. And we see already a little bit of that in some countries. I see that where telemedicine was coming up and teleconsultation. As soon as it's possible again to go face to face to the hospital, all those numbers drop. And I'm not saying they need to stay up here, but we need to make sure that we maintain and keep and build on what we've learned. And we can only do that now. We need to do it fast. Otherwise, habits will have gone back to where they were before, and the window of opportunity is lost. So in that sense, fully agree with the moment is now to make those changes to make the system more resilient and more efficient moving forward.
Great, thank you very much, Janneke. Now, I'd like to turn to Momir and Klemen with a slightly different question, which came up in our preparatory conversations before today's meeting, which is also within the context of accelerating access to new treatments, therapeutics, solutions, diagnostics, etc., and the broader capacity within Europe for this to happen. One of the points that was explicitly mentioned is the number of independent experts that Europe has available to it, in particular the European Medicines Agency, to process and analyze the data across a vast range of conditions. So in this context of how we accelerate access for patients, I wonder from both of you, perhaps Momir first and then Klemen to follow, what do you think we need to promote, what we need to invest in, what we need to prioritize in policy for this capacity to be in place for acceleration and improved access for patients? Momir, to you first.
Thank you for the question. So in terms of the access, I don't think that a rolling procedure will become on our standard way, because we know that we have a conditional market authorizations with vaccines, and so many things needs to be done in this direction. But of course, if we have emergency out there, some things can be fast forwarded. Definitely, we need to think about regulatory flexibility, what happens in when crisis evolves, and I'm sure HERA, the new body which will come very soon, will cover a majority or most part of that problem. And I'm convinced that Europe has all the expertise, but we need to also have a political level to act jointly, because member states often refers to these subsidiarity principles, and sometimes rightly so, but a lot of questions are indeed a matter of national competence, but that should not prevent us to cooperate and coordinate efforts. So if you look from the dossier perspective, it's really hard to automate that. It's really hard to digest that faster because, for instance, for vaccine dossier looks around 60 to 100,000 of pages, which needs to be critically assessed. And we need to assess it from the really competency-based view. But there is also some level of mistrust in what we can do better. And I'm definitely a fan of digital technologies, but sometimes we cannot even find a way which data to collect, how to collect it in a structured way, able to be able to analyze it, and of course to apply this advanced analytics. And sometimes we even have issues with digital literacy. So a lot of different things needs to be done. And I would just point out, for instance, electronic prescription, 15 data points that need to be actually agreed on the EU level, and that was already a hurdle. So we need to actually work much more in the same direction in order to do that. One of the options that we could do that are patient registries. So this parent patient registry, which could help us actually to gather data faster and in a more sustainable way. And I'm sure we also need to find the regulatory mechanisms to be able to decide faster also in the regulatory world.
Great, thank you. Now, Klemen, this question is, what's your take on it?
Yes, thank you. For me, as a politician, the most frustrating was actually the fact when we were faced with the fact that, for example, American FEMA was able to, the American regulatory body was able to make a very speed and still a very efficient and competent decision, while EMA was saying that they cannot do it as fast as their American colleagues can do it. So what I think we need after the COVID-19, we need a regulatory framework which will be responsive, efficient, and safe, and which will be effective and efficient and safe in any conditions, being a normal one or in crisis. So this is what we need. We need some flexibility because it's not only the question of safety, at the end with the end user. The question is also the process how this final decision is made. If there are cases when, let's say, another institution from the United States made a decision, then the public actually has a question why in Europe we cannot do the same, because there is no doubt that the decision of the American regulatory body was competent, was expert-based, it was taking into account all aspects and all questions. They had the same amount of papers to look into it, the same amount of data they had to went through, analyze them, make a decision. So the process itself is more or less the same. But why did it take so much time for EMA in comparison with the American regulatory body? So this, what we need to have in Europe is a stronger, I would say, stronger EMA, which would be, as I said, which would be capable of being responsive, efficient, and in the end, also have a decision which will be proving to the public that the medicine or the vaccines are safe. And this is something that we need in the future. So if this needs some changes in the legislation, then the European Parliament, I'm sure, will be able to do it. But I think that we need to do something also in the sense that we need to make EMA stronger in this expert level. So we need additional experts, we need additional human resources for EMA. I think this all can be achieved because this is the moment when this decision needs to be taken, and this is the right moment to do it. In a few weeks or a few months' time, this will be all forgotten. As it was said before, telemedicine was a huge success story a few months ago. Now, if you look in the national resilience and recovery plans, you will see how many countries, member states, included this telemedicine in their national plans. There are not all, there are a few of them.
Thank you, Klemen. Now, I think, Momir, did you want to quickly comment? And I think, Janneke, you also want to respond to that as well. Momir, if you'd like to go first.
Thank you. I would just actually add what Klemen said. I fully agree that we need to work faster, but some of the things cannot be automated. So we really need to put more resources in. And if we compare EMA to FDA, they have a few-fold difference in terms of human resources. And I'm sure we need to work to find a way to be faster because, like I said, it's if you have a public health threat emerging, we need to be fast. And then EMA took a different approach. We decided for conditional market authorization, and that for this you need a randomized clinical trial of phase 3. And in US, they did emergency use. This is less data is needed. So for instance, for emergency use, they need phase 2 trial. And this is the big difference why they can they can be faster and they can decide also in a shorter time frame. And that is maybe also one of the options that could be explored in next legislation open up, which will happen also very soon.
If I may add
very quickly, and then to Janneke.
Yes, this is what I'm saying. We as a politician, we don't know exactly what the experts would like to do, but there are differences in the procedures from the FDA and EMA. So let us know what we need to do, what changes are needed to the regulatory framework, and what changes are needed to the legislation. Because I think that if the United States has this emergency procedure, I don't see the reason why Europe shouldn't have a similar approach, a similarly expert-based approach. If the question is only legislation, I think there is, I would say, political will to do it now. I'm sure that in 1 year time, if things, let's say, hope will get for the better, that this political will be, I'm sure, much lower as it is now.
I think we will see, and also to echo a comment from one of the audience. Yeah, the US is one country. EMA relies on resources from the NCA, which makes it less efficient and workable. EMA should have dedicated resources. So there you go, something for the Slovenian presidency to pick up along with the parliament. Now, Janneke, you've been waiting very patiently. Let's hear from you now, and then we're going to pass to Francesca, and we're going to talk a bit about digital infrastructures. Janneke, over to you.
No, what I wanted to add is that you asked a question about, how can we speed up access to innovative technologies across Europe? And, Klemen and Momir, of course, have very eloquently addressed the first step, which is the EMA approval and what we can do there. But obviously, there are other factors as well that then drive, how fast an individual patient in a country finally get access to a new technology. And I'm not talking about the COVID vaccines, but more in general. The way I look at it, I see 3 buckets of delays or areas where we have room for improvement. EMA, as just discussed. Then you have the country by country pricing and reimbursement processes where we see massive differences and massive inequality in a sense in Europe between some countries taking 2 months and others taking 2 or 3 years to go through that process and also work with the industry, right, to go through that process. We clearly also have a role to play there. And then, okay, even if there is approval and there is reimbursement in a country, then you still have, of course, very often a long delay before the right patients actually receive that right intervention for them. And there is massive room, I think, as well for all of us to collaborate in that end stage and how we make sure that, and again, data and digital will help, that the right patients get diagnosed faster, get their final treatment faster. And I just want to also say here to the whole audience that for us as Novartis or as the pharmaceutical industry, we are very willing also to work with local governments to see if we can look at different models of collaboration. Francesca mentioned public-private partnerships. And just to mention one example in an area that is relevant for all of us, cardiovascular risk, still the biggest killer, bigger than COVID in every country in Europe, where we have struck as one example, because it's public, a very innovative way of working together with the NHS in England, where we have a joint commitment to address the biggest cardiovascular risk factor, which is hypercholesteremia, high lipids. we have collectively set up a program that should be rolling out later this year to identify a very specific high-risk patient group and to actually vaccinate them with innovative technology. It's a twice-a-year treatment, so it can really run like a vaccination approach. And this is a totally different way of bringing a medicine to market. It's where the NHS, and in this case, our company, work together to see how we can save 30,000 lives over the next 10 years and prevent 65,000 heart attacks. That is the joint objective, and it's a very different way of working together and something that I would love to explore in more countries.
Terrific. Okay, well, thank you for that, Janneke. Listen, we're going to switch topic to digital and in particular digital infrastructure. And I'm going to put Francesca on the spot here because there's a great question from a member of the audience. Do you believe there's been a market failure in the provision of comprehensive health and care digital infrastructure?
Well, I don't think there is an issue of market failure. I think there is an issue of the information infrastructure being still quite weak. And this, I did mention there's been a huge acceleration in digital solutions and tools during the pandemic. The starting point was a quite sore one in the health system, as I mentioned, lagging behind decades compared to other sectors in the economy. So if you look, for example, at the needs that COVID-19 has very much put to the fore, the need to have a very robust health monitoring system. We do need very, very much integrated data system that really cut across the continuums of care, of health and social care. We need to have more harmonized approaches to data governance that enable to link data at the individual level and to provide a full picture of what happened to the patients. We need to make sure that data can be shared in a safe way, that can be accessed, within countries, within different parts of the health system, and also across countries. In the context of health emergency, the importance of that. Well, is this happening? No, very, very little. And that's a matter of data governance, which is just not ready there. So it's even in the moment in which COVID-19 arrived and struck, there were a handful really of OECD, or if you want, of EU countries that were able to generate information to support decision-making, clinical decision-making, and also policy decisions in real time. Only like 4 countries were able to generate, from hospital data sets, for example, data in real time that would support, on a daily basis, that would support critical decisions, whether for system governance or for clinical patients, also for decisions about treatments and even innovation. So I think there is a fundamental need to address this data infrastructure, which really has to do with having more harmonized, more standardized data systems. We clearly also are lagging behind in terms of having data which are comparable and standardized, particularly on outcomes. Even measures as simple as death, at the very beginning, particularly in the pandemic, but even right now, if we want to compare a measure of death from COVID-19, we just realized that the standards are different across countries. Are we including death only in hospitals or also in the community, in the long-term care sectors and so forth? There are variations even in measuring something as simple as that. And critically, when we're talking about more outcomes of patient-reported outcomes and experiences, it's quite clear that we're very far away from being able to collect data which are standardized, which are comparable across the health sector. And I think there is also, in terms of the data and the digital, a gap to be still filled in our ability to leverage and to make use of the data. So we often say health systems are data rich but information poor. So the ability, for example, to use data which is routinely collected and generated in health systems in order really to facilitate efforts for optimizing care, but even for recovery, if you want, even to generate early warning system in the case of health emergencies and so forth. The ability to use that routine data is very, very poor indeed. And I think there is still a lot of investments that needs to be done. And that has to do really with the overarching governance of data in the health system.
Obviously, thank you very much for that. And obviously, there's a lot of talk at the moment about how the recovery and resilience funds may be used by different member states to build up on the infrastructure side. But a related question to Klemen, to Momir and Janneke, are we overlooking the data issues in parallel, that we're in a rush to revitalize the infrastructure and the platforms or physical platforms on which healthcare is delivered, but we're leaving the data issues out of the equation? Does anybody have a particular thought on that?
I would say that for politicians, if you look from a political point of view, it's very much more attractive to have a physical hospital open and built through the funds which are coming from the recovery and resilience fund. The problem with the digital, I would say, is it's not tangible. You cannot see it, you cannot feel it. People like to see it and feel it, but the importance of digital is even bigger, even though it's not tangible. Data collection is one of the most difficult endeavors in human activities. Whoever was a researcher knows how difficult it is to have a data collected, then how to proceed this data. So the data analysis are very demanding. So if you have I would say that we need to have a standardized data collection analysis which are based on science proven methodologies. And this can be of paramount importance for the future development of health systems. If COVID proved anything, was that what was already said, there are 27 national approaches to data collection, to data analysis. What we need in this sense, and this is, I think, where European Union can play a major role, is to have as common standards, how to collect data, which data, how to handle data, because cybersecurity is a very important issue, because we must remember we are doing with a GDPR sensitive data, because these are personal data. Your healthcare status is something which is very intimate for everyone, for every of us. So every one of us. So this is something where European Union can do, could and should do much more. But I'm afraid that if you are looking in the recovery and resilience funds, the majority of money will be at the end spent on physical infrastructure. I hope some of it will be also used for the development of knowledge, investments in education and so on, in research and development. But unfortunately, or due to objective or more subjective reasons, there will be a lot of physical infrastructure built, not necessarily needed one.
Great, thank you, Klemen. So, Momir, Janneke, do you feel optimistic or pessimistic about the direction of travel at EU policy level to address these data issues?
So I feel more pessimistic based on what Klemen just said. I think, I guess I understand that politically, of course, it is easier to do something that has an effect in the short term and that responds to an immediate public ask, right? Building physical infrastructure. It's true, of course, that the impact of building a fantastic digital infrastructure will only be seen in the mid to long term and is harder to sell. But I guess I would ask us all, what legacy do we want to leave? How bold do we dare to be at this point in time when all eyes are on healthcare? Do we, do some quick fixes or more superficial short-term activities, or do we dare to really be more fundamental in the change and invest in what we all know is going to be leading to better outcomes in the long term? And that would include digital infrastructure. So that is really the question, I suppose. How bold and daring and long-term thinking do we all together dare to be?
Thank you, Janneke. Momir, any thoughts for you on this topic? And then we'll move on to, I think, our final theme for this.
Well, just one thought. So nothing is growing faster than data available. But the issue is actually that we don't collect it in a structured way. We don't analyze it. And of course, we're lagging behind in health with data analytics. So we first need to decide what is actually our low-hanging fruit. And I see, for instance, from COVID-19 perspective, one of the areas that we could explore is platform trials. So this means that we test multiple therapies in one indication, one therapy for multiple indication, or both. And these novel clinical trial design. So if we build in infrastructure to get this data, this can dramatically increase cost effectiveness or drug development and leading to this life-altering medicines for people who are really suffering from serious diseases. So I think this is one of the areas that we need to move fast and in order to get the best therapy for the patient and to have this patient-centered approach.
Wonderful. Well, that's actually an excellent segue into what I think is going to be sort of the final topic / question, because there was a great contribution from one of our audience members who says the following: how can we turn COVID-19 into an opportunity to improve health equity and access to adequate healthcare for all? And I think there are a couple of parts to this. One is obviously in the programs and the instruments that are already being developed at European and national level. But there's also a kind of a mindset which links in with the spirit of cooperation and partnership that has been catalyzed by the COVID experience. So I'm going to use this as sort of our final question. Francesca, I'm going to invite you to address it first about the
sure, I mean, it's a very broad question, but I think what COVID-19 has really shown is also significant underinvestments in health systems. And there is probably a need to do two things. On the one hand, to make sure that there is value-based health system, that what you spend on delivers improved outcomes. But at the same time, it's quite clear that if we look at some of the foundational elements of health systems, so the information infrastructure data, we have mentioned that. I will add to that also the health workforce. We have not mentioned that at all, but it's quite clear that there is a huge shortage of health workforce. And so I think there would be an opportunity to use this crisis to invest more into health systems to start with and start to address some of the critical weaknesses that existed. Think about also the primary healthcare, for example. That's an area which really requires much more investment. I think that would be really the starting point. I think there is a need also to make sure that we use this crisis to make health system more agile, making sure that we are able to surge capacity when there is a sudden increase in demand, making sure, yes, that you can have quick decision making. We talked about obviously quick access to treatment and accelerations. That might also what we've seen in terms of huge successes during this crisis is a huge amount also of public government funding that went into stimulating and accelerating the development of vaccines. So could there be perhaps a different role of governments as well in terms of stewardship and directions for accelerating the developments and access by working on identifying R&D priorities more for the population from a population level perspective, and then working also with the private sector to think about new different models for sharing risks for development, a new perhaps mechanism for funding, but also public-private product development partnership and this type of models, which would require obviously certain responsibilities on the side of the private sector as well. But I think there are things which have been brought forward by the pandemic that we can build on in the future, but it does require as a starting point an agreement about what should be the high level, high priority R&D objectives from a population health perspective.
Wonderful. I guess it's also in line with this question of how do we align agendas to address real public health needs, right? And deliver health solutions that are seen as sort of public goods as well, not just private property. Momir, let me invite you to give your closing thoughts on this question about seizing the COVID opportunity and delivering health equity and adequate access for all.
I will be very practical and straight to the point. I think if one thing that could be actually used is joint procurement. We can use this for high-priced medicines, as Janneke was mentioning, delay on so many levels. I think we cannot afford that we have delayed access to one life-saving therapy. So one of the issues that we could push on the EU as an EU solution is actually joint procurement for medicines wherever we find this appropriate. Second thing that I would like to point out is this high-level R&D perspective. We know that we will deal with the antibiotic resistance in near term, because we're losing the old antibiotics and we're not having enough new antibiotics. So definitely we need to find a way that we will have a promising pipeline here and to make a way to have them on the market. And I'm sure Europe can be a global health leader here. And then we really need to think how to, as it was already pointed out, which data should be collected, analyzed, and to do this in a structured way. And just maybe to start not with all areas, but with the areas that are bringing evidence to the healthcare and that can be easily done. And then at the end, I would like also to stress out the repurposing. For instance, we have so many medicines which are used off-label and could be used on-label if we do the trials. So maybe we also need to think about different regulatory pathway for those kinds of medicines. At the end, I would just like to stress out that together with all stakeholders, we can decide that all can be done. Thank you.
Wonderful. Very upbeat. Thank you for that. Now, Klemen, you have the penultimate word. What are your closing thoughts?
I would say that we need less rigidity in the system, in the health systems. We cannot expect flexibility because they are huge systems usually, and huge systems are not very keen of being very flexible. So less rigidity in the system. I would say that we should try to persuade them to use more innovative approaches, new technologies, new models of management. Then one of the issues which was not mentioned today is the demographics, because demographics have huge impact on the fact what kind of national health system you need. And this is now once again related to digital and also to data collection, because good set of data can prove you what you need in the future. You can make a better future estimates of what you need, how many, what your future needs will be in the health area. We know all that we have a limited human resources in healthcare systems, so we need new technologies. So telemedicine is one of them. This is what I was thinking under the new models, which parts of the health procedure can be done with telemedicine, which needs to be done in physical way. I think that COVID proved this and exposed all these issues, and now is the way forward. But the way forward is actually, as I said at the beginning, and I will finish with this one because I'm a very keen proponent of it, we need to invest in research and development, because without research and development, we will not have new technologies, we don't have new knowledge. It is not necessary this knowledge will be useful at the moment, but as we proved also during the COVID, sometimes something which was researched 10 years ago can be very useful in the present time. Thank you.
Terrific. Now, Janneke, the final word for you.
Thank you. So maybe 2 points from my side. The first one, as already mentioned, the massive inequality that we have in terms of time to access caused not by EMA, but by the different reimbursement processes, as Momir mentioned. If we can accelerate those, that will already reduce a big source of inequality across Europe. And then maybe second one, cardiovascular risk is the biggest killer in Europe. And it's also a disease area where inequalities are very prominent, right? There's a massive difference, as we all know, in terms of cardiovascular death in terms of different parts of society. So I guess my call to everybody here and to everybody on the phone would be, we have an EU cancer plan. You know, what about have also together writing an EU plan of how to address this biggest risk factor, this biggest killer in Europe, and the one that creates most inequalities? Who is in to develop a cardiovascular plan?
Well, that's certainly an ambitious call to action, and I think it goes hand in hand with this spirit of increased cooperation across the value chain and across all the key stakeholder communities who have a vested interest in more effective and more impactful health policies and programs going forward. So let's watch this space, European Cardiovascular Action Plan to complement cancer and AMR. But in the meantime, I think we will draw our conversations to a close. First and foremost, I would like to thank Klemen, Momir, Francesca, and Janneke for their time, their contributions to today's panel discussion. Secondly, I'd very much like to thank you, the audience at home, for your patience in sticking with us as we resolve some of the Zoom issues. And last but not least, a sincere thanks to Novartis and the team here in Brussels for their support in making this event possible. So I hope that this has been an enlightening, inspiring and stimulating set of discussions, and we look forward to having you join us again for one of our public webcasts in the not too distant future. Thank you again for your time. Stay healthy, stay well, and we will see you again soon. Goodbye for now.